Hello, everyone, and welcome to another episode of What, and Why. My name is Toyin tfal&chi. I'm an infectious disease physician, and I'm really passionate about amplifying the incredible work of women researchers, especially around in the field of HIV. Today, I'm joined by my friend and colleague, Dr. Tina Agbaosi, who will introduce herself. And we're going to talk about something exciting that she has piloted. And I am incredibly excited to have this conversation with her. It's really about patient education with HIV and how we communicate to empower people. So, thank you, Dr. Agbaosi, for joining us. And could you introduce yourself?
Hi everyone, thank you so much, Dr. Toyin, for having me. I'm Tina Agbaosi. I'm an infectious disease specialist and I'm really passionate about infectious diseases, HIV, and everything about infection.
And Dr. Agbasi will tell you a little bit at the end about how you can reach her and follow her for some of the amazing work she's doing. But today we're going to really focus on a visual way of communicating HIV information, and this is from her work in infectious diseases. So, like I like to start off with the show, the what, right? So, what was the unmet need that made you decide to go ahead with this comic book or visual representation of information?
Okay, so today we're talking about what I like to call my HIV spiel. So it's a conversation I've had with my patients over the last 15 years. Every single patient I've had the privilege of seeing for HIV, I had this conversation with them. And it came from a sense that a principle that I've had really that when anyone knows better, they would do better. Because I don't believe patients really just go out of their way to be non-adherent or negligent about their personal care, about their health. Once they know the reason behind why they're doing what they're doing, they would do it. So that is really where it came from, and it just I've been doing this for the last 15 years, and I've seen it make a really great impact in my patients.
Wow. So we'll dive into that. But you highlighted the unmet need, which is really a lot of times people talk about, oh, somebody is non-adherent, they're not engaged in care, and all of these things. But like you're saying, right, have we empowered people with the why behind why it's important to stay in care and why it's important to stay on your medications when you're living with HIV? And so this is something that you've been doing routinely as your spiel in
Absolutely.
clinic.
Yes. So what happens is I usually always ask the patient, what organ system, or tell me what you know about HIV. A lot of times, those who have had HIV for several years, they are happy to tell me what they know. And then I kind of give them almost like a curveball. I say, what organ system does HIV, specific organ does HIV infect or affect? A few of them will say the immune system, but most of them, the vast majority of them, will say all the organ system. And that's usually the door opener for me to start what I try to tell them. And I use this analogy of a war, like a military metaphor of HIV, the patient being a territory. Like they are, I say, think about yourself like you're the United States and you're a territory and you have an enemy invading your space. And so the virus is the invading enemy. You are the territory, and your soldiers are the CD4 count that's supposed to help protect you. And so that they form the immune system, like your defense system, like the Pentagon of your territory. But HIV virus doesn't go to the White House, which could be like your brain, doesn't go to the heart or to your lungs that could represent the Senate or the judiciary system. They go for the defense system, and they systematically knocks down your immune system, eventually keeping you open and exposed to every other enemy. So that kind of helps them see the transition for a period of how you can be infected and not have symptoms, because you don't have a headache, you don't have any urinary complaints, you don't have any cough, but you may actually be having the virus infecting and breaking down your immune system until the situation, until the time when your defense system is completely gone, when the CD4 count is really low, what we would describe as AIDS clinically, and any other infection begins to manifest, what we call opportunistic infections. So I usually just see the patients just get it, and it always delights me when I see them. Their faces just change, their expressions become enlightened. Really, you just see the enlightenment show up in their expression.
Wow, I love that. And I like the analogy about how they go directly to like get to your immune system, right? And the fact that you may have HIV, living with HIV with no symptoms, right? And so that's important, especially as people remain on therapy and even when they're feeling fine, so they don't stop therapy because they know what it is they're trying to do. Wow.
Yes. And I don't stop there. So
Yeah.
we actually keep moving on. And so once they understand that, okay, the defense system of your territory is the target for this invading enemy, then, and I tell them, I say, well, on your own, your soldiers are completely helpless. And I usually just illustrate and say, this is how your soldiers are. They're like in surrender mode to the virus. But thankfully, we don't have to stay in that surrender mode. And then I bring in the medication. Usually I have a box, a pill, example, and I say, here is your ammunition. That once you have this, then your soldiers are suddenly armed, and then you have a chance to fight. And and then they just get it. And the funny thing is, just last week, I had a guy who has had HIV for about 12 years, a young guy, so he's had it from his adolescent, and he told me he's had a lot of resistance, right, and because of poor compliance. So he was telling me, he said, doc, literally, he said, since you told me about the soldiers and the ammunition, it has helped me be consistent with taking my medicines. And I literally almost gave him a hug because I was so happy, because that's the way I interact with my patients.
Yes, yes. Those happy dances, celebrating celebrating wins, and because it's tough sometimes to stay with all the things that people have going on, but when you have a healthcare provider that explains to you the why and is also there to celebrate with you, and even when you fall off, is like, let's do this because we know why we're doing this. So that's
Yes.
really, I know you and I have talked behind the scenes about just many examples of times where you have used this spiel and this conversation to empower people to be able to have people do things that they need to do.
So
Yeah.
that was a big win. That was just one more big win for me. That even though it takes a few extra minutes in my visit, I feel like it's absolutely worth it. And one thing that it does for me and the patient, we're able to interact on that level, because I had a patient who was calling over and over again because the lab was messing up with his results, and he said, I need to know my soldier numbers. I need to know how my soldiers are doing.
It is incredibly
So that
empowering.
way we're able to interact on that level. And then the final end of that story is helping them see that if you do some when your soldiers are armed, after a while you start feeling well, everything starts going okay, there may be the temptation to want to stop taking your pills. And so I help them see that you don't want to, because even though you're winning the battle, the war is still on. Because in a live combat, when you're winning and the enemy usually would retreat, right? Most of them will be killed, but the enemies will retreat, and that's very similar to what happens with HIV in the blood.
Yeah,
So
undetectable.
it's undetectable because you're winning the battle, but the war is still on. So you have to stay armed. And then I help them see that if you do, people who make up their mind and they stop taking their medication, it's a bad thing, because it's like yanking their ammunition or their guns from the soldiers and then going back into that helpless mode, which ends up becoming an opportunity for the enemy to come back stronger. And that's basically what HIV resistance is. And so most of them are like, I do not want that to happen to me, because they just get it. Why don't you turn this into something that everybody can benefit from? And that was where the idea for the book came about, that Dr.
Let's have that
Nwafor.
conversation. Yeah. And I've had the privilege of looking through it, and I know our listeners will definitely go download it. Is that you also talk about U equals U, undetectable is
Exactly.
untransmittable. What happens when the virus is suppressed and how you're no longer able to transmit. So it's incredibly
Exactly.
empowering for the person. It also probably, I would see, for some people who are not able to have that conversation with family members or loved ones, to be able to use that comic book to be able to say, no, as long as I'm taking my medications and I'm undetectable, I am no longer transmittable, which is
Exactly.
incredible. I love that in your book also. Yeah.
Exactly.
Have you found that what are some of the other things that you found in terms of just socializing and having it available for people to have conversations with? Does it open up more questions that people have?
Well, it has opened up questions, especially because I feel like especially the part about resistance, that was one part that I believe the patients really did not completely have a good understanding consequences of resistance. So this just really puts it right there in their face that, well, it gives them a visual, something that they can almost imagine, they can fully imagine that this is how resistance comes about. And so I tell them, I'm sure there's the cure for HIV is in the horizon, but we have to stay the course, especially for those who have been on HIV treatment for 30, 20 something years. Stay the course. Don't give up. Just keep going. And then it's important for them to know also, like you said, with the U equals to you, that as long as you're winning the battle, you and your family members and your partners, they can stay uninfected as well. So
That's great. I like that so much. And I like the fact that you do this conversation with.
the big thing I would like to share is HIV is not anything like the illness it used to be. It still has that reputation. Like everyone still feels like, oh, it's deadly. If you get it, it's a death sentence. And yes, it is. But you don't have to be in the path of death, of the being in the dying from it. Nobody needs to die from HIV in 2026. And that's what I tell my patients, that HIV right now is a chronic illness. And I say, knock on wood, if you have to choose between HIV or diabetes, go with HIV. I'm saying that tongue in cheek, but the reality is, if you're taking your medication, it's so easy now for you to stay on course and live a really healthy, normal life while you're on treatment, and not transmit the virus and live a long, full, healthy life on HIV. I tell them, your grandma has been taking a pill for high blood pressure or diabetes all her life, and it's the same thing. It's just another chronic illness, and we need to break from the stigma. It's not a moral failure. It's just another disease, and it's really been a joy having to do this. And I count my blessings every day and the privilege to talk to patients and just connect with them in that way.
Wow, thank you so much, Dr. Agbaosi. And for healthcare providers, for people living with HIV, for community members, for the general public, just to understand HIV, this is such an incredible resource. You're able to download it. And Dr. Agbaosi, as we close out, can you tell us where our listeners can find you?
Well, I'll share a link on my Beacons page on where you can download the book free of charge, and you can print it and put it in your reception area. It's enjoyable, I tell you. It's it's an enjoyable read.
Yes, yes, yes.
And I would encourage all healthcare providers to have this conversation with their patients. I would love for everyone to adopt it, because I've seen it make a tremendous difference in my patients kind of accepting their disease, and also taking control, that they have the power to charge the direction in which the outcome of their illness. So
Thank you so much, Dr. Agbaosi. It was a
thank you for
pleasure.
having
And
me.
again, thank you for listening to what, and why. And it was my incredible pleasure to be speaking with Dr. Tina Agbaosi today. Thank you, everyone. Bye-bye.
Thank you.